why do people not really know about high insulin? Why was it not part of, the discussion around diabetes? And so like, why does this seem like such a foreign concept, even though in some ways it's so like fundamental to a common health condition like diabetes?
Right, right. I believe there are two reasons why we persist in having, and why it even began this way, a glucose-centric view of metabolic disease, rather than what I contend should be the case, which is an insulin-centric view, and that's due to history and science. Historically, the most obvious sign of diabetes was the excess production of urine. That's what diabetes means. Diabetes means polyuria. In other words, producing a lot of urine. And that high urine production is directly a result of high blood glucose. Now, these ancient philosophers, scientists, physicians, they couldn't measure glucose in the blood, but they could taste some alteration in the urine. And it had an altered taste, which is why the real name for diabetes, the full name rather, is diabetes mellitus, or sweetened urine. Glucose doesn't taste very sweet, but I suppose what was most obvious is that animals, dogs and flies, would come and want to lick that urine up because of all the glucose that was in it. And so they knew something was there. So historically, the most obvious manifestation or sign of the disease was because of the high glucose in the blood causing high urine production, because the glucose spills from the blood into the urine and into the kidneys, going into the urine, and that pulls a lot of water with it. And so the urine production goes up dramatically. And then scientifically, it wasn't until just a handful of decades ago that we could measure insulin at all. We've been able to measure glucose for well over 100 years. And so there were scientific hurdles to measuring insulin. And even now, though that we can measure it as easily as we can, it still involves taking blood at a clinic and then the clinic sending it to a lab. And so it goes through that multi-step process that involves multiple characters. In contrast to glucose, people can prick their finger and get their glucose levels immediately. I'm wearing a little device on the back of my arm that can tell me my glucose levels every minute of the day. And it's scientifically easier to measure glucose than it is to measure insulin. So collectively, historical precedent and sign and symptom, as combined with the scientific ease of measuring glucose, it's somewhat forgivable. Not somewhat. It is forgivable that we've focused on glucose for so long. But the more we're learning about insulin and the dynamics between the two, it's becoming less and less forgivable. Case in point, if we have these two variables, glucose and insulin, we've always been tracking the glucose. In fact, indeed, every year the patient comes in and we measure glucose. We measure glucose again and again and again. And we say, well, you're getting hypertension, you're getting infertility, you're having migraines. But we don't think of there being any metabolic connection because the glucose is normal. But if we were to take a step forward, I could say, and measure the insulin,
Right.
What's happening is that we see the insulin climbing for decades, 10 or 20 years before the glucose ever changes. And then eventually the glucose changes. But because we don't look at the insulin, which nowadays is not very forgivable, it's easy enough at a clinic, we measure the insulin and we can detect the earliest signs of this metabolic disarray. We know they've gotten off the healthy metabolic path and are now on the wayward metabolic path. And again, glucose can't tell us that when they've taken those first steps off. By the time glucose changes, they've been on the wayward path for years, decades perhaps.
Yeah, well, there's a lot to unpack there. So, but so first of all, like historically, you were saying that diabetes was kind of first recognized through other signs and symptoms, obviously besides high insulin, because nobody had any idea what high insulin was.
Right.
And so in the beginning, it was kind of like, oh, you're peeing a lot and it's sweet.
Yep.
And I've heard stories about like medical school a long time ago, people or the doctors used to like taste the urine to see if it was sweet. I don't know how often they did that in real life, but you hear about that sometimes.
Right. It's the stuff of legend, regardless.
Right. So the diagnosis of diabetes long ago was you had a lot of sweet urine. And then the three P's of diabetes, it's the polyuria that you said, and the polydipsia and polyphagia. We learned this in medical school or PA school and whatnot. And the other ones mean that you're drinking a lot and eating a lot.
Hmm.
So you get thirsty because you're peeing all the time. Um, so that's kind of the history of diabetes. And then eventually people learned how to measure the blood sugar. And so they started tracking the blood sugar and kind of basing everything on that. And then, more recently, we've kind of become able to measure insulin. Now, I've actually never had my insulin level checked because I don't go to the doctor that often and whatnot. I'm sure if I went now for a checkup, I might ask them to do it.
Hmm.
But
Hmm.
I could go check my blood glucose right now while we're on the call because I got a little finger stick glucometer. So
Yep.
yeah, so like you said, it's so much easier to check your sugar, but the insulin, you said that the insulin will be high decades or 10 or 20 years
Hmm. Hmm.
earlier. So to put that in perspective, if you have somebody who develops type 2 diabetes, the more common type,